What I wanted to talk about today is, I think, very helpful for people calling in who haven't been into the dentist in a while, right? So I want to go over it from our side on being my front office person and from me understanding the patient side of it too, because of course I've been there. But what I'd like people to get out of this is how you're going to make the best out of that outcome. I'll explain a couple of scenarios. If it's been a while since you've been in to see the dentist, so let's just say that you were used to going in for cleanings as a kid, and then you get into that dangerous period that I think we've talked about before, when you're on your own, typically in your lower 20s up until 30, and then you realize, gee, I haven't had a dental cleaning in 6 years. And so you call and you want to get in for a dental cleaning. So that's one way that Melissa, my front office person, is going to be receiving that new patient call. The other scenario that you could appreciate is, let's say you got a married couple, the husband's eating dinner, the wife notices that husband's kind of staying away from a particular tooth and wincing as he's chewing, and she's like, honey, what's going on? And he's like, I've been noticing this tooth is hurting. I've told you to get in for a dental appointment for the last 4 years. You need to get in. And so the wife will call and say, my husband's having a toothache. So the second way people come in is for a dental emergency, right? Third way, turning one of these landmark ages, let's just say 40. I know you're far away from that, right? But it comes fast, and you notice you're looking in the mirror and you're kind of getting ready for this landmark date, especially if it's 50. You're like, yeah, I think my teeth are yellow, or I've been noticing this tooth isn't where it used to be. When you start noticing things on your body changing and you don't recognize them, and it's like, is that me? It's like, this is not the way my smile looked when I was 20. So you call in, you want a cosmetic consult. That would be the third way. And the fourth way is, if you're a small business owner, you've been just busy building your business, or you're a single mom and you've been busy bringing up the children, and now you look at yourself and you're missing a couple of teeth, and your teeth are crooked, or they may have shortened quite a bit, and you have accumulated a number of issues, but you just haven't had time to get in there, and you've just grunted through the discomfort and through the inconvenience. But you know now, hey, it's time for me, and you want to get a plan to get your dental health back in order. So those would be the main ways that people call. Now, on the dental side of it, what I'm talking with my staff about is, I want people to come into the practice establishing a relationship, so I understand that person as an individual, not just as a set of x-rays. And so I'm wanting to spend the time, if I look at it like a long-term relationship, I'm going to want to get to know that patient and go over, as we talked about many times, the cornerstone of the practice, which is the new patient exam. But for that patient calling in, wanting to get that cleaning off their list, it's an inconvenience, because I just need a cleaning. I need to get this thing done. My wife told me I need my teeth cleaned up. I don't want to do an exam. And you mean when I come in for the exam, I'm not getting my teeth cleaned? Listen, I appreciate that. I really do. And what we want to think about is what's going to be best for you in the long run. So what is going to be best in the long run is that we get you healthy, and that we try to minimize your dentistry over a lifetime, and that we get you to 100 with all your teeth. The only chance we have at that is if we look at you as a whole and see what that plan is going to be for you and what your vulnerabilities are and prioritize the treatment. So that is not to say that you can't come in these other ways, because people do, and we understand that. So obviously if you're in pain, we're not getting you in for a full exam. We're going to handle the pain. But what is going to be my first comment to you after we handle that is, let's get you back in and let's reassess things and see how we can avoid this problem in the future. 100%. Or let's say that you're a college kid, and you realize it's been 3 or 4 years, but you are preventative minded, and you want to come in for a cleaning. You know what? That may be a good time for you to just come in for cleaning and make sure that you don't lapse and that we don't put obstacles in front of you before it's a long time before you come in for a cleaning. So, that would come down to some questions. And so if you were that person calling in and I was Melissa, I would say, okay, you need a clean. When's the last cleaning that you've had? Oh, it's been a year and a half, I think. It's typically a little bit longer than what you remember. That's not bad. I mean, depending on your risk factors, within a year and a half to 2 years, it's not like the wheels are going to come off. And then the next question would be, well, tell me a little bit about your dental health. Do you have many issues? No, every time I come in, the checkups are good, and I think I've had 2 or 3 fillings. Fantastic. You know what? Let's get you in for the cleaning. Dr. Saylor is going to do an exam when you're in that day. We're going to get a basic set of x-rays and go from there. It sounds like you're in pretty good shape. Or if that person calling in for a cleaning says, yes, it's been 6 years. Now that's a bad thing, right? That's too long. Can the wheels come off in that amount of time? Absolutely. So we don't even know what type of cleaning you need in that situation. So we're going to try to recommend that you come in for the full exam, and we would do our best. Well, if it's been that long, you're not going to get a cleaning that day. We're going to see what's going on. We're going to get you back in. We're going to find out what your baseline of health is. And that is going to be in your best interest. Do we make exceptions to that? If we absolutely have to. Somebody that's wanting the cosmetic exam, what we do there is we just think of that exam as kind of a screening, and we call that a cosmetic consult, and there's not even a charge for the cosmetic consult, because what we're trying to do is find out if what you have in mind, if you have anything in mind, actually that you're a good candidate for that. So we explain to the patient, hey, this is going to be a 20-minute exam. It's by no means comprehensive, and it is strictly to see, you're thinking about whitening, but you don't know because you don't know if that's possible because it's been a while. We're going to look at it and say, yeah, you're a straightforward whitening case, you're a straightforward bonding case, or you're a veneer case, or you've got a lot more going on, and your next step is going to be, as we say, measure 3 times, cut once. So we're going to get you in for the exam process after that, after your cosmetic consult, right?
Just to see if there's like a need for crowns versus veneers,
yeah,
decay and all that.
Right, because you're not wanting to, put a fresh coat of paint on if the walls are falling down.
Right.
So we're trying to assess the overall health. And again, it's always, as I tell my staff, it's always what's in the best interest of that patient. That's the way we approach it. Because if we think about it like a long-term relationship, you're not going to want to start off, if you meet somebody and there's potential in a relationship with that person, you're not going to want to start off with false narratives or false pretenses. So we want to make sure that we're starting with the end in mind, but still addressing your concerns, right? Because until somebody's been heard, they're not going to listen to what you have to say. And so we are very empathetic when it comes to that. Now, that other patient who already knows they have a lot of issues, we see a lot of that because, after all, we are a practice that specializes in adults that have significant dental issues that need treated now. So that is our primary specialty, And so those patients already know they're going to be in for an exam that in those cases, they may not even see me that day. They're going to come in for what we call data collection. And we're going to get all the data gathered so that when they come in for the next appointment, which is the Codiagnosis tour of the mouth, they're going to sit down with me, not having to worry about impressions that day or photos that day or x-rays that day, because all that has been done by my trusty staff, probably Hector, that day that they come in. And we try to explain to them again why we're doing that. Because it's nice in that appointment, if they can sit back and we have a meaningful conversation without me digging in their mouth, we're looking at the screen. Look at this. And they've never seen these photos before. They're like, whose mouth is that? And it's a very helpful process to go through the Codiagnosis, tour of the mouth, when I'm not digging in your mouth and talking to you and you're trying to answer with two hands in your mouth, right? It's a more dignified process, and it's a very good way to understand, take ownership for your dental health. And so that would be the second appointment. First appointment, data collection. Second appointment, tour of the mouth. And then the third appointment is where we actually do a review of findings and go over the plan and talk numbers. So it's not like we're trying to ignore the all-important cost of the treatment. It's because I don't really know, and I don't want to misspeak and tell you, I think it's going to be around $5,000. And then when we get to the review of findings, well, it's $10,000. Well, listen, patients, even if I tell them, hey, this is just an estimate, they're going to say, you said it was $5,000. I've learned, I don't open my mouth until I know. And again, that's trying to set a baseline for a good relationship. So I would like patients to think about those different scenarios. Think about which one you may fit into. That way, when you do call Melissa or call whoever and try to establish that dental relationship, think about it in terms of, I am trying to establish a long-term relationship here, and I'm going to work with the dental office, and they're going to work with me to make sure we're starting on the right foot. We're starting with good information, and we're starting with the intention of getting to maintenance. And maintenance is like I joke around with patients. Hey, once you're in maintenance, you're not going to see me much anymore. You're going to miss being on my side. I'm going to ask about the kids. We're going to talk about the weather. Probably not going to be doing dental treatment once you're in maintenance for a long time, and that is the goal. And in a mature practice, the only way you can grow is new patients, because your existing patients are not needing a lot of work. I don't think we've done any work on you in a long time. You'll get there, but it's going to take a while, and that's fine. That's the goal. We know we've succeeded if all you're seeing is my hygienist, and you're happy, I'm happy, and if we just started with a quick cleaning, you would have never met me in the first place. You would have never really understood what the major plan is. There wouldn't have been a long-term goal, and you would have gone to whoever was on your new plan of the day. And that is, that may be a new way of doing business, but it's not our way of doing business and doing dentistry. It's much more relationship-based, and that doesn't appeal to everybody, but I think there's still a lot of people who are interested in that type of care.